Okay, we're doing this book here, Prevent and Reverse Hypertension by me, Pete Rogers. We're doing we're actually on part 13. Okay, it's actually chapter 2, Hypertension, Atherosclerosis, and Heart Disease. So here is patterns of atherosclerosis. Typically, coronary artery atherosclerosis of the heart is referred to as Western atherosclerosis. Intracranial atherosclerosis in the arteries inside the brain, that is called Asian atherosclerosis. The cervical carotid, you can primarily think of that as Western. Okay, it could be either one, but it's thought of as Western. Okay, so here is the heart's down here. Those are the coronary arteries. They go around the heart like a crown. So they're called coronary. Here's the ascending thoracic aorta, aortic arch, descending thoracic aorta. Here is the right carotid. Here's the left common carotid. Bifurcates into the external carotid where there's a bunch of branches like the fingers of a hand, and then the internal carotid going up to the brain. This is a middle cerebral artery, anterior cerebral artery over here. Here's middle cerebral artery, MCA. So anyways, who gets this? Asian atherosclerosis, prototype population, the Japanese in the 1960s. They're eating tons of salt, 12 to 14 even more grams per day. They're smoking like chimneys, lots and lots of hypertension. Isolated hypertension on a low-fat diet will tend to cause injury to the arteries from the high pressure, intracranial atherosclerosis. High-fat diets are especially associated with plugging up the coronary arteries. Okay? That's Western versus Asian atherosclerosis. And of course, lots of Americans have both. Okay, here's the blood pressure. The systolic number is the one on top. Diastolic is the one on the bottom. A normal blood pressure is like 110/70. Here's a severe hypertension patient, 200/100. Top number systolic. That's Greek for contraction. Diastolic is Greek for relaxation. Lots of medical words are named after either Greek or Latin equivalents. Okay. Oh, I talked about the Windcastle effect in my recent video about does heavy weightlifting with squats increase the risk of overstretching the ascending thoracic aorta, because it has elastic fibers, and the elastic fibers during diastole, they recoil inward, and that generates diastolic flow. Diastolic flow is important because it helps maintain continuous oxygen and glucose delivery to the brain. Also, you get retrograde flow through the coronary arteries that supply blood to the heart. You can only supply blood to the heart muscle during diastole, the left ventricle, because when it's contracted, it's too tight. It compresses all the capillaries, so they have to be relaxed, the left ventricle, in order for the capillaries to have adequate flow to deliver oxygen and glucose to the left ventricle muscle. The left ventricle muscle is much thicker than the muscle of the rest of the heart because it pumps at a higher pressure. The pulmonary pressures from the right side of the heart are very low, so you don't really need very thick muscle. But the LV, it's the big muscle-bound cardiac chamber. Windcastle effect's like the thing you blow air on the fire for kindling. Okay, the more hypertension you get, the more you overstretch those diastolic fibers, those elastic recall fibers, and the less able you are to perfuse your coronaries. Okay. All right, here is Reow Formation. So Reow Formation is stack of coins in French, and what it basically means, I was talking about this a moment ago when I was talking about my other book, Prevent and Reverse Obesity, that the chylomicrons, the triglycerides, the LDL cholesterol, they all stick red blood cells together. And when they stick them together, the blood thickness is increased, the blood viscosity is increased. The reason you have a blood pressure is to pump blood to the top of your head, cerebral cortex, to pump that blood against gravity. Normal blood is thin like water. When you have the fat sticking the red cells together, it becomes thick like a milkshake. To pump a milkshake, you have to pump higher pressure to get it up there. And then if you eat sodium, you vasoconstrict the arteries, you narrow their diameter, so you have to pump higher pressure to pump all that blood up through narrow arteries, thick blood. It's like, if you put your finger over the hose when you're washing the car, it comes out at a higher pressure, higher velocity. And when you increase the blood pressure, the blood velocity, it hits against the artery walls with more pressure, and that will damage the artery walls over time, and that leads to atherosclerosis. Okay. Okay, here's a picture of the Zeta Potential, what that's about. So Zeta Potential means a negative charge on the outer surface of the red blood cells. All the red blood cells have this, okay? And it's generated by a couple things. You got Pscialic Acids on the outer surface of the glycosaminoglycans. They have a negative charge. But the big part of the negative charge comes from the repeating disaccharides like heparan sulfate, okay? It comes out of the glycocalyx. First of all, you'll have a core protein sticking out of the plasma membrane of the red blood cell. Okay, that'll be like a syndican core protein. And then I have what I call the 666 rule. I know that's a bad number, but it works in a useful way for understanding the glycocalyx of a red blood cell, of any cell. Okay, so what does that mean? 600 is how high let's say here is the plasma membrane. That's how high the glycocalyx extends above the plasma membrane, okay? 600 nanometers. And then about this high right here is how high, let's say this is a vascular cell adhesion molecule, VCAM. It's about 60 nanometers above the plasma membrane. And then the plasma membrane itself, that's about 6 nanometers in height, okay? So what happens? If you have very high pressure, it smacks against the arterial wall, and when there's an excessive amount of high pressure hitting the arterial wall, you get excessive turbulent flow, excessive retrograde eddy currents. The endothelial glycocalyx gets confused because that's not supposed to happen. It didn't happen to our ancestors in nature who ate these low-fat plant-based diets. So it'll start to shed its glycocalyx, its antithrombotic glycocalyx, and then sitting there exposed now will be these vascular cell adhesion molecules to which the white blood cells, red blood cells can bind and form a clot. Atherosclerosis is a blood clot. That's a very important thing to understand. You should hit the print screen button and type atherosclerosis is a blood clot. If you get that, your understanding of atherosclerosis pathophysiology will go way up. These are fundamental points I'm teaching you in order to enable you to understand things. You have to understand that there's a zeta potential. You have to understand there's a glycocalyx. You have to understand that high blood pressure damages the arterial wall and causes clot formation on the arterial wall, and that clot is atherosclerosis, okay? One of the things I have, doctors tell me all the time, gee, I never understood any of this stuff until I talked to you or watched your videos. Yes, thank you. That's why I'm making these videos, okay? I feel sorry for you. I feel sorry for your patients. I'm teaching you how it works so you have a chance to help people. Okay, something that sticks the red blood cells together is called a bridging molecule. LDL cholesterol does that, triglycerides do that, chylomicrons do that, IgM antibodies with an acute infection. That's why people often thrombose blood vessels during acute infections. Uric acid will do it. That's why you don't want to drink a bunch of high fructose sweetened soda pop. And the fibrinogen especially is more thrombotic when you've got bacterial endotoxins floating around in the blood. That's a big disaster, LPS and LTA from leaky gut. Okay, here's a pscialic acid, and these sit at the ends of the glycocalyx. So right on the far tip, you would stick them on right there. So imagine these pens are pscialic acids, okay? So my hand would be the end of the glycosaminoglycan, and these pens would be, on the tip of it would be the pscialic acid. The immune system comes by and it feels the pens and it says, yes, you belong here, okay, you are self. And if you have the wrong pens, like let's say these other pens were sticking up, and the immune system felt them and said, no, you are not self. This cell must be removed. And it'll then release all these chemicals to bind to it that are like eat me stickers for the macrophages to come along and eat that cell. Okay, so the pscialic acids themselves have a negative charge, which contributes to the zeta potential. Zeta potential is a negative charge on the outer surface of all cells. It's on the outer surface of the red blood cells. It's on the outer surface of the white blood cells. It's on the glycocalyx of the red blood cells. It's on the glycocalyx of the endothelial cells. Okay, this is a fundamental property of cells, and it's genius. It prevents them from sticking together. They all repel each other by their negative charge. Albumin has a negative charge too. Okay, here's just showing that LDL cholesterol is positively charged and it overcomes the zeta potential. So it'll increase, the higher the LDL cholesterol, the higher the blood viscosity. That's why lowering LDL cholesterol lowers your risk of atherosclerosis, because it lowers the tendency of the blood to clot. All right, you know what? I think we'll get this. We covered a lot for one day. I'll go through all this laminar flow stuff in the next lecture. So I hope you found that helpful. Trust me, I've been studying atherosclerosis for over 30 years. What I'm telling you is the real secret of understanding it. If you get this, it'll be a walk in the park to understand this. And if you go see your MD, you'll know it better than them. And that would be rather humorous, don't you think? So, all right, these are the great secrets of atherosclerosis. It took me decades to figure this all out. And you'll see once we go through all this, it totally makes sense. And it's easily understandable about what to do. Become a low-fat vegan, obviously.